Good morning. Today was another victory in the battle with COVID-19. Only 4 positive cases were reported. This makes more than 2 weeks of single-digit daily new cases. We have some of the lowest numbers of cases in the country, and we have flattened the curve. Now we can continue our phased approach to reopening our local economy. As I've said before, there are some key metrics that we wanted to achieve before we began reopening our economy. We need a declining trend in COVID-19 cases, enough capacity in the healthcare system, including the capacity to handle a surge, and a robust testing and contact tracing program. We have achieved all of these metrics, and I'm pleased to announce that today I will be signing the 7th Supplemental Emergency Proclamation, which allows more businesses and organizations to reopen and restart their operations. The proclamation now allows residents to leave their homes, to patronize certain businesses and activities, and to reflect this new approach on our COVID-19 response. The stay-at-home order is now referred to as the Safer at Home order. Under the new Safer at Home order, the proclamation identifies phase 1 of our reopening. This is the stabilization phase. The stabilization phase allows for a reduction in restrictions for businesses classified as low risk from a health perspective. An important consideration was the ability of the businesses to keep both employees and customers safe and their ability to follow social distancing guidelines. With phase 1, the following businesses and activities can reopen. Non-food agriculture, including landscape, floral, and ornamental, astronomical observatories and support facilities, car washes, pet grooming services, healthcare and social assistance, including elective surgery and non-emergent services, nonprofit organizations, retail businesses and services, including apparel and electronics, shopping malls, and wholesale and warehousing operations. These entities may reopen effective May 7th at 12:01 a.m. These are in addition to those businesses previously announced by the state and counties, which include florists, certain real estate services, car dealerships, automated and mobile service providers, services provided on a one-on-one basis, and golf courses. All of these businesses and activities must continue to follow social distancing, sanitation, and workplace safety guidelines as outlined in my emergency proclamation. The proclamation also includes a list of resources that organizations can use for additional guidance. COVID-19 has taken a devastating toll on our economy, and this is the first step in reopening businesses and getting people back to work. I want to assure you that we have been working closely with the Hawaii Emergency Management Agency, the counties, the legislature, and our Economic Recovery and Resiliency Navigator to develop our reopening plans. We anticipate making further announcements in the coming weeks. For example, we are looking at the timing and guidelines for reopening businesses such as restaurants, personal services like hairstylists, and places of worship. But the health of our community is still our overriding priority. We have seen a recurrence in several places around the world, and we need to make sure that that doesn't happen here in Hawaii. So if we experience a second wave of COVID-19 cases, some of the restrictions may need to be reinstated. Your efforts have made this reopening possible. Your vigilance and commitment to social distancing is helping us win the fight against COVID-19. We are not out of the woods yet, but we are getting there. Keep up your social distancing, wash your hands, stay home if you're sick, wear your masks, obey social distancing requirements of businesses and activities, and keep in mind that although we encourage you to patronize the newly reopened businesses and activities, you are safer at home. So please take care of yourself, take care of each other, and most importantly, help to take care of our community. Thank you.
Governor, opening it up to questions right now from Manolo Morales, KHON2. Who is handling industry-specific safety protocol reviews for reopening? In other words, who should businesses be submitting reopening protocols to for approval, and what will the turnaround time be?
Certainly we are working and looking at the CDC guidelines, and the Department of Health is in contact with the federal agencies. We have had meetings and discussions with the local representatives of agencies like the National Restaurant Association and others. There have been many guidance documents issued, and we continue to work with all of the federal, county, state agencies to find the appropriate guidance and distribute it to all of the members in our community.
Thank you, Governor. This is from Daryl Huff, Hawaii News Now. If a business opens under the order, can they order their employees to come back to work, even if the employee is afraid? What are an employee's rights in that situation?
Certainly, the guidance does provide for appropriate personal protective equipment if needed, depending on the nature of the business and the potential for interaction and contact with customers. The CDC guidance puts a premium on keeping employees safe, and certainly we would expect that businesses would do the same.
Governor, this is from Jennifer Kelleher, Associated Press. Any plans or guidance for reopening schools, including summer school?
We certainly continue to have the conversations with the public and private schools about summer school and what happens next fall. And we will continue and provide those announcements as the decisions are made.
Governor, this is from Max Dybel, Big Island Now. Can people congregate again outdoors? Will this include beaches? And what are the group numbers that are acceptable?
No, once again, we don't include any change in the guidance, which means that people should not be congregating, that if you are outside and you're shopping, we expect that you'd be patronizing the businesses alone or in family clusters only.
Governor, this is a follow-up from Daryl Huff. But if an employee still doesn't feel safe, can they refuse to work?
Certainly, they can, contact the OSHA office if they feel that it's an unsafe environment. There are many specific guidelines about the requirements for various industries, and certainly contacting the OSHA office would be appropriate if they feel that they're in an unsafe situation.
Governor, this is from Manolo Morales. Councilwoman Tsunayoshi is introducing a resolution urging you to provide specifics for reopening the state's business and visitor industry. What is your response?
Certainly we are finalizing the total plan for reopening. There have been a number of meetings going on throughout the community with various stakeholders and organizations. So we continue and will be making that announcement as appropriate. We felt that it was very important that we provide this information as soon as possible. We will be providing more details on the full plan, identifying what the guidance and guidelines would be, looking at other businesses that continue to not be allowed to operate.
A follow-up from Manolo, KHON2, Governor. What do you think of her safeguard policies, such as requiring documentation that incoming visitors have been tested and have received a negative result?
We continue to work with the airline industry and the FAA and others that are involved with inter-island, interstate, and international travel. And certainly we don't control all of the parameters. We can implement a quarantine, and we have. And certainly we are looking at other measures that would be required in order to reopen up and really drop the mandatory quarantine for inter-island travel as well as domestic travel, and then finally international travel.
Okay, Governor, this is from Ashley Mizuo over at Hawaii Public Radio. What is the specific plan if the cases begin to increase, and what would constitute a significant increase?
We do have a framework of the health metrics that includes looking at the rate of transmission, that includes the number of cases that we are seeing, and includes the metrics on the healthcare system, so the utilization in hospitals of intensive care unit beds, as well as ventilators. And we will be publishing those guidelines in the next few days.
Governor, from Daryl Huff, HNN, will there be any enforcement involved with Safer at Home order, or is it essentially impossible to enforce any effort to keep people home with so many places they are encouraged to patronize?
I certainly appreciate everyone in our community taking responsibility and following the social distancing orders and mandates that we've implemented. I do expect that the overwhelming majority in our community will continue to put our community first and honor the social distancing guidelines. That has really allowed us to be successful and really allowed us to manage the number of cases, manage the numbers of contacts that we need to keep track of, and I think most importantly has really reduced the number of fatalities here due to COVID-19. And we will be working with the counties to enforce the measures as appropriate.
Governor, just clarifying that our reporters have not yet seen the 7th supplemental emergency proclamation. Daryl is also asking, are all shopping malls free to open or only open air shopping malls? And are there specific recommendations for how to keep a shopping mall safe?
Certainly there are specific guidelines or limitations on shopping malls. So we'll be issuing the proclamation very soon.
Governor, this is from Manola Morales, KHON2. Who can enforce the mask rule inside the store as retailers are concerned when customers take their masks off inside?
Certainly we would expect the businesses to, police what occurs in their establishments and places of business. Should there be a need for further enforcement, we are talking to the malls, making sure that their security people are aware of what the requirements are and can help enforce it within the malls. And then finally, certainly the access to law enforcement, state, county, and state would be available if it becomes necessary.
Governor, this is from Ashley Mizuo, HPR. How could we have achieved adequate contact tracing when the recommended number of people doing contact tracing is 30 tracers per 100,000 residents, and DOH has less than the 10th of that?
I know that there are lots of different parameters around contact tracing, and there are guidelines that run the whole gamut. We do know that we have sufficient contact tracers, and we can provide the specific details of what we would be doing in scaling up. We did put online a new program that we believe helps to facilitate and allows us to keep track of more people with fewer personnel involved. And so I think all of these things would become an important part of the framework that's necessary to reopen our economy.
Governor, this is from Robbie Dingman, Honolulu Magazine. Are there other states that you feel have set effective policies that you're using to help model your plan?
A lot of our policies are being driven by the CDC guidelines. the whole notion of phase reopening, I think, follows the level of activity that is occurring in each and every state. And I think most importantly, it includes the status of our healthcare system and the capacity in our healthcare system to handle COVID-19 cases, as well as other health issues that arises. And as we've said repeatedly, the utilization in our healthcare system is at the levels that we believe allows us to be able to manage and handle the COVID-19 cases, in addition to additional non-emergency healthcare activity. And so certainly we feel comfortable moving forward at this point in time. We do believe that all conditions for our environment has been met. And certainly we'll be monitoring those conditions moving forward. And I would just like to remind the public that there may be a need to reenact the restrictions and implement social distancing requirements if the number of cases accelerate too quickly.
Governor, this is from Wendy Osher, Maui Now. With more businesses reopening, has the state considered child care services for families that must now return to work? At what phase will they be allowed to reopen?
Certainly we're working with the child care providers. As you may be aware, the CDC guidance on child care and education facilities do have social distancing requirements and other suggestions about what a safe child care facility and an educational institution would look like. So, we continue to work with the local industry to examine what the guidelines are, and we do know that child care is an essential part of bringing our workforce back. So we are working with the industry and employers to ensure that employees have access to child care.
Governor, from Blaze Level Civil Beat, what businesses would be included in phase 2? If you just think about all the businesses that are not open now, we're going through them systemically to look at, obviously the high risk types of activities, large sporting events, large gatherings, certainly are at the highest risk, and we continue to look at what the guidelines say in those areas and whether how easy it would be to implement measures to reduce the risk. So all of the remaining businesses will be evaluated, and we'll be making decisions about how we might be able to phase those businesses back to be reopened, whether there are specific recommendations from the CDC or other professional associations about best practices in maintaining social distances and health care requirements. And so we will be looking at all of those things in deciding when and in what time frame those businesses would be allowed to reopen. Governor, Daryl Huff asking for clarification. So this order does not reopen nonprofit child care facilities then?
It does not reopen nonprofit child care facilities. That's correct.
Okay. Also from Daryl, nonprofits could include churches, but you say places of worship are still to be closed. What activities would still be barred in a church?
Certainly for all of the nonprofit community, any gathering obviously would not be allowed yet. So I know that many provide services in various ways into the community. Those activities would be allowed to occur, but no activity that would involve a gathering.
Governor, from Ashley Mizuo, HPR, are hospitals prepared for a potential surge of patients who have been putting off procedures for the past 6 weeks? And are there specific guidelines in place to continue social distancing in hospitals? There are specific guidelines in place working with Federal Department of Health and Human Services and the local leadership of the healthcare facilities here. We've had extensive conversations with the healthcare industry. Certainly, we're not requiring explicit action, but we are enabling them
to make decisions about allowing more discretionary or non-emergency kinds of procedures to proceed, especially if they can be done on an outpatient basis or if it doesn't compete for the kinds of resources that would be necessary to respond to COVID-19. So we are working with the facilities so that they can manage the activity in their facility, at the same time be prepared should there be a surge of COVID-19 patients.
Governor from Manolo Morales, KHON2, how soon do you see restaurants opening for dining in?
Certainly we're discussing that. We've received the guidance that has been issued by the National Restaurants Association. We're talking with the Hawaii Restaurant Association and really having, I think, a good conversation about reopening plans and phases and what would be helpful for them. I would say that the restaurant industry in general is very health conscious, and certainly there are lots of current regulations that they have to comply with in regards to cleaning and sanitation within their facilities. So we continue to work with the industry to think about what the appropriate phasing would be.
Governor from Daryl Huff, HNN, are you planning to bring more state workers back to their jobs from home, especially those unable to be productive from home?
Certainly we are looking to bring back state employees, and the counties are looking at doing the same. We'll be phasing back. For those who are able to fully complete their duties, teleworking, we are encouraging. The state will be encouraging continuation of those who are able to work at home. But certainly we are looking to bringing back all employees as long as we can do the work in a safe manner, that we can implement appropriate social distancing requirements to reconfigure office spaces and ensure that our employees can be safe.
Governor, this is from Kevin Dayton over at the Star Advertiser. What is the specific plan for scaling up DOH contact tracers, and by how many?
Certainly the Department of Health and will be providing specifics. They do look internally first, and so as you know, public health nurses in the public schools, for example, with the school shutdown, were available. So they have been working. There are healthcare professionals in the department that normally do other work that has been reassigned to help with contact tracing. We also have agreements and looking to expand those agreements with John A. Burns School of Medicine for medical students to be involved with contact tracing, with the School of Nursing at University of Hawaii and their students to be involved with contact tracing. We're also working with the university to establish targeted training programs that would allow us to train other personnel such as National Guard and others to provide us the surge capacity necessary for contact tracing.
Governor from Ashley Mizuo, HPR, what should parents do with their children if they must go back to work but do not have childcare? Is there a provision allowing workers to stay home if there are no childcare options available?
No, we don't have any specific guidelines or requirements should an individual not be able to get childcare.
Governor from Daryl Huff, can shopping mall food courts operate with reduced seating, for example?
No, shopping mall food courts would be allowed. The restaurants would be allowed to operate in takeout only. The cafeterias or the food areas would not be allowed for dine-in.
Governor Manolo Morales asking, can you provide specific guidelines for retailers opening?
Certainly the proclamation does include specific guidelines for all businesses and all employers reopening, and talking about implementing social distancing requirements, identifying capacities of space where customers would be coming in, providing requirements for social distancing and queuing lines. Those general guidelines are part of the emergency proclamation. Again, we require personal protective equipment as appropriate, depending on what the situation, to be provided to employees. And the order still continues to require masks, cloth masks, when people are out and about or visiting various retail operations.
Governor Brenton Awa, KITV4, asking, can people go back to the beach for non-exercise purposes if they maintain physical distancing?
No, people are not allowed to go back to the beach to just sun on the beach. They can go to the beach to exercise, just as I think all of the parks are reopened for exercise purposes, but gatherings are still not permitted.
Governor, from Robbie Dingman, Honolulu Magazine, is the state considering offering coronavirus antibody testing to its employees?
We're not looking specifically at antibody testing for state employees at this point in time. Dr. Park and Dr. Anderson is looking at antibody testing and thinking about what would be the appropriate place to have antibody testing in the state's testing program. As you know, the local labs have stood up the capacity for antibody testing, and so certainly we'll be incorporating antibody tests as appropriate. At this point in time, there hasn't been a specific situation that the antibody test can really respond to.
Governor, from Kevin Dayton, Star Advertiser, is the state expecting an uptick in infections as the local economy reopens, and will you be taking additional steps to address that?
We do anticipate that there would be an increase in the number of cases, and we definitely will be monitoring that. Again, we asked everyone to maintain their social distancing activities. If you're sick, you should stay at home and self-isolate, should not be going to work. If you believe you may have COVID-19, you should self-isolate. I think it's very important that we maintain the social distancing activities because the only way for us to keep COVID-19 in check is for people to not have the opportunity to infect someone else if you're infected with COVID-19, or for you as an individual to be infected by someone who does have COVID-19.
Governor, from Daryl Huff, HNN, how do you define how many new cases would constitute a wave enough to close up again? Would that be a county-by-county decision?
Certainly, we've had discussions with every county, and we are tracking the cases individually, actually by island. It's more than just county by county. We do report the cases to Maui County, for example, Maui Island, Lanai, and Molokai separately. So we will be evaluating. I think one of the most important capabilities that allows us to reopen our economy is the fact that we have ample testing capacity. The public and private labs now have the capacity to complete more than 3,000 test runs per day, which is what some of the projected suggestions are in terms of testing capacity. Everyone in Hawaii today has the ability to get tested for COVID if they have a reason to. So for those who are symptomatic, they should be getting testing, working with their healthcare providers. For those who are close contacts of confirmed COVID-19 cases, they can get testing in a number of locations all around the state. And that's a critical part of why we believe we can reopen our economy.
Governor, from Jennifer Kelleher, Associated Press, what about dance studios that offer group classes, other businesses that offer group classes, gyms? Which phase will these businesses be considered for reopening?
Certainly those businesses are higher risk because of the nature of the contact and the numbers involved. So they are being looked at in second or subsequent phases of the reopening.
Governor, from Blaze Lovell, Civil Beat, are the county mayors in agreement with reopening these businesses?
Yes, we've been talking for more than 2 weeks now just about reopening activities here in the state. They reviewed our suggested list of businesses, and we do have consensus that moving forward at this point. In addition, other mayors are looking at specific nuances that are specific to their counties, and we'll be looking at those businesses and activities as well.
Governor, from Ashley Mizuo, HPR, will tourism be in phase 2? And if not, what is your best estimate when Hawaii will reopen to visitors?
We are looking at, we do know that as long as there is a 14-day mandatory quarantine on travelers coming to the state, that the number of visitors will be and will continue to be very low. So we are working with the industry to think about what the conditions would be to lift the mandatory quarantine. We know that there needs to be a way for us to track visitors to ensure that they are healthy, and should they begin to develop symptoms of the virus, that they need to be isolated, and we need to provide them health care. So all of those issues are part of the conversation about reopening our economy for visitors from out of state.
Governor, this is from Wendy Osher, Maui Now. She's asking, the Maui Chamber of Commerce is requesting a mandate that restaurants be allowed to sell sealed containers of alcohol. Do you have input on this, or is this up to the interpretation of the Liquor Commission?
That is mostly a Liquor Commission requirement. We did include in our emergency proclamation the ability for restaurants to sell closed containers of liquor as part of their takeout and delivery services. So that was a request that we had from the industry. They felt that they could do it in a safe way, and we did allow liquor commissions to allow that exemption to current law.
Governor, this is from Daryl Huff, HNN. The nonprofit sector is very large. Can you give us an example of a nonprofit that is not allowed to operate today, but will be able to operate starting Thursday?
Well, any nonprofit that is not involved in an essential business or in support of essential infrastructure should not have been operating. And with this proclamation, the nonprofits would be allowed to operate regardless of whether they were considered an essential business or regardless of whether their activities supported essential infrastructure.
Governor, from Robbie Dingman, Honolulu Magazine, is the state advising most businesses to begin planning to go back to work or to maintain work from home if practical through the end of May?
We encourage all businesses to maximize the use of telework and work from home. Obviously that allows us to have the best scenario of social distancing while keeping our economy going and our workforce productive. As we know that some work and some activity just does not lend itself to telecommuting and teleworking, and so obviously those employees would have to show up to offices and do their work in that way. But certainly maximizing the opportunities for telework is part of us being able to manage the number of COVID-19 cases and to reduce the risk of infection.
Governor, this is from Jennifer Kelleher, Associated Press. Let's see, regarding the quarantine, do you have any idea, have there been any travelers who have been turned away at the airport for showing symptoms such as fever? Have any tourists tested positive while in Hawaii?
We have had instances of people in quarantine being tested positive. So I don't recall whether the case was specifically a resident returning in quarantine or whether it was a traveler in quarantine. But we have had instances where people in quarantine ended up becoming symptomatic and then getting COVID-19. What's the second half of that question?
Well, she asked for a number, and I told her
Yeah,
that
I don't-
DOH will answer that.
Yeah, we might be able to get that number from Department of Health.
Okay. Governor, this is from Manolo. How soon can you lift 14-day quarantine for inter-island travelers?
Certainly we are looking at that, but I don't believe, we have to close the gaps that we have in quarantine right now, working with the screening process, the county law enforcement, as well as HTA and others to really close the gaps in our ability to enforce the quarantine. And then we would be looking at what way would we be able to ensure that infected individuals don't come to visit the islands, and if they do, if they become sick while they're here, that we can provide them health care and isolate them so that they don't infect residents with the virus.
Governor, an education question for you from Ashley Mizuo, HPR. Should DOE be keeping track statewide of how many children have been unreachable during distance learning? Right now, individual schools are responsible for that, but don't necessarily have to report it to the department.
Certainly the the education professionals at the school are really closest to the children and are in the best position to, identify any gaps in being able to reach and teach children. Teachers are required to be in contact with students, make sure that they are learning the lessons and making progress through the enrichment activities. And certainly, those closest to the children are in the best position to ensure that the students are able to learn and that they are receiving the services that they need to be successful. Certainly we can look at gathering summary information, but many schools were doing different things, and we thought that it was very important that schools take the responsibility because many of them are doing different things to be able to reach the students that they serve.
Governor, one last question for you, or maybe last couple of questions. This is from Daryl, HNN. Do you have any new estimates of the drop in state tax revenue? Do you expect this reopening will ease the pressure on the state budget?
No, we've made projections, but the tax collections in May would be the first tax collections that really have the large impact of COVID-19 and its suppression and impact on the economy would be most evident in the May tax collections.
Governor, this is from Megan Fernandez, Pacific Business News. Many grocery retailers and businesses have been limiting the number of patrons in the stores. Does the state expect shopping malls to also limit the number of people inside once malls reopen? And if so, how?
Right. So certainly we will be asking the malls to manage the social distancing and ensuring that social distancing requirements and stopping the gatherings and collections of people. We are asking the malls to help with the enforcement of those activities. As I said before, state and county law enforcement would be available if they are unable to maintain and implement the social distancing requirements of the mall. The state and the county have the ability to shut down the mall if we feel like social distancing requirements cannot be implemented and enforced by the mall. Certainly that's not something we would want to do, but we certainly are prepared to do if we believe that the health risk is higher than it should be.
Governor, one more question here. This is from Ashley Mizuo. Any projections on how many workers this phase would re-employ?
We don't have a good number. We continue to talk with industry representatives to get a sense. We know that there are still many people unemployed, and we will continue to look at ways that we can safely reopen and restart our economy and allow us to manage the number of COVID cases so that our healthcare system is not overrun.
Governor, one more. This is from Brenton Awa, KITV4. Could astronomical observatories being allowed to reopen impact TMT?
No, it doesn't really impact TMT. As you know, there are 12 observatories currently up on Mauna Kea, and they have been they voluntarily shut down, and certainly we believe that their operations can be done in a safe way that doesn't risk employees or the general public.
All right, Governor, if you have your closing remarks.
No, so I really just wanted to thank each and every one of you. We are able to move into this next phase because all of you have really taken the restrictions to heart, have really implemented the social distancing and the stay-at-home orders that we've ordered previously. And we believe that our community has the conditions that allows us to move into this next phase, the safer at home phase of our COVID-19 response. We would still encourage you, if you're sick, you should be at home and you should not go to work and have the opportunity to infect others. If you are going to patronize any of these businesses or nonprofits that are now open, we would encourage you to return home because it is safer at home than it is out and about. And finally, we encourage businesses to allow telework because it's very, very important for us to maintain social distancing. We have to be prepared and we have to live with the COVID-19 virus, for the next 12, 18, 24 months. And so we all need to be prepared to monitor the health conditions of our community. If we do see an increase in the number of cases, we'll need to ratchet up the restrictions so that we can keep our community safe. But we do believe that we are ready for this next phase of reopening and restarting businesses so that some parts of our economy can return to normal. So please, thank you so much for being here. Please take care of yourself, take care of each other, and most importantly, help take care of our community. Thank you.